Hello, everyone. Thank you for joining us today, uh, and thanks for your patience as well. I will now share my screen here, and I have posted a link uh, 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 for a Google document in the chat, and what this provides is a tutorial or a guideline on how to access data set from Statistics Canada, and also links to the hospital quality ratings, um, and other information. And I will continue to share some links that will provide you with some details and website links on how to access data or where to go to get data for Canada and for international comparisons. All right, so I will now start my presentation and at the same time remove my video link. Okay, so it's easier. All right, here we go. We can all see the PowerPoint.
Yes.
Yes.
Okay, thank you. All right, so what we have today is my objective is to be able to share some of the links and also to provide information on where and how to get access data sets. Now, this is really a presentation for our graduate students and for trainees, and also for our health professionals who might want to understand the trends or just look at what is happening in different provinces or for Canada as a whole, and also to see where we stand globally in terms of our healthcare for maternity care. Yeah. So I would again like to acknowledge the traditional, ancestral, and unceded territory that I'm working from, which is of the Musqueam people. All right. So today's presentation is being hosted by JEPS at the Birthplace Lab. And my name is Nisha Malhotra. I'm a health economist at the Birthplace Lab at UBC. And so I'll first start off with what our plan is for today, right? So we're going to mainly talk about the regional and national trends within Canada, and then we'll look at some international comparisons, and then we'll go on to talk about some hospital indicators, quality indicators in perinatal health. Now, what I have seen and observed over time is that although these resources and these statistics exist, they are not as often accessed and they are not discussed so much. And I feel that there are all these resources that can be used in our research as well as in our discussions of Canadian healthcare. So that's a gap I'm hoping to fill. So there are three main data sources that we will be accessing today. So this is really a seminar which is how to access data and what is out there being provided by Canadian statistics and as well as by CIHI. We'll also look at OECD's results, and then we'll go on to what I think is very rarely used stats from CIHR, which is looking at patient experiences. Right. Now, so the first one that we are going to be looking at is the perinatal health indicators that is provided by our public health agency. And this is the Canada's Canadian Perinatal Surveillance System. And well, the data comes in two parts. One, you can look at the quick stats, and they also report the main indicators, which is on the right-hand side in terms of their publications. And they also have something like data tool, which is what where you can go to download larger data sets. Okay. Now, their data comes from three sources. So you can think of this resource as, or this place as, a accumulation of three data sets. One that comes from the CHI DAD, and the other is from the CCHS, and then vital statistics, which reports births, stillbirths, and death database. Now, CCHS, which is the Canadian Community Health Survey, in order to access it, you have to um, um, either use their microdata files, which is available publicly online, and you can download them from Statistics Canada. And these are large data sets. And these have been aggregated to some extent so that privacy is not a concern. And CCHS is available every 2 years, and their focus changes over time as well. But the main questions remain the same, right? And so what the surveillance system reports is information on births, the related health behaviors, and also critical indicators like cesarean rates and obstetric trauma. So let's begin with some of the stats that they report. So again, this is coming from the surveillance system. So this data that they report is from the DAD 2022. So we have the number of births and number of stillbirths and birth rate, which we are looking at, or you can think of this as fertility rates as well, per 1,000 women. And the cesarean deliveries, which is now reaching 34%, and the severe maternal morbidity, which is 17.5 per 1,000 hospital deliveries, a slightly higher number than I would have expected, but that's where it stands as of now. I think most of us are aware of some of these stats. The number of births over time has been declining. Now, when you go and access the data sets, this is the Excel sheets that you do download. I will now recommend that you access that document that I have shared the link in the text. Tomorrow, if you can reshare that link, that would be fantastic. And so if you access the document, you should be able to find information on how to download this data set. Okay. So this is what I did. The graph that you see here is from the downloaded data, and which has been now graphed, visually represented. So what you see is births in Canada, which is has its short-term trends as well as overall. What we see is that the total births from 2018, since the pandemic, has been on decline. Live births. And so the difference that you see is stillbirths. And this gap between total births and live births has been on the rise. And this has been happening since 2010. And if you look at the mean age of mothers at time of delivery in Canada, there has been a slow increase, although this seems to be a sharp rise. Please note the y-axis. It is a move from around 28 as a mean age to 32. And I will be sharing these slides online. And so what you see at the bottom here is the link where you can go and download this data. And at times, the link provides you with where I have accessed those stats. So this is really how to seminar, And so all the details on where to go and get these stats is available on every slide. All right, so this is just to go into a little bit more detail about stillbirths. Again, all these stats that you see or the visuals that you see are publicly accessible from the data sets that you can download. Yeah. And so what we see in terms of the stillbirths, I'm going to focus here on stillbirths in single births. And sadly, these have been over time been on rise. And keep in mind that we are not seeing any, we're not accounting for other factors. And so on its own, we can only see the trend, but we would have to be looking at other variables to see why and how this is playing out. Yeah. So this is the trend we see for stillbirth in case of single births. Now, the surveillance system also provides health-related behavior. And if you see on the right-hand side, the data is being accessed from the health service. These are self-reported measures that we're looking at. Yeah. So this is the Canadian Community Health Survey, and these results are from the 2022 survey that was conducted. Yeah. And so this provides us with information on folic acid supplementation. And what we see here is that for the periconceptual period, the supplementation was 54%, which is higher compared to if you're just looking at for the reproductive age. Proportion of women who report smoking during pregnancy is at 4.2%. And again, this is for 2022 data, and this is self-reported. Maternal exposure to secondhand smoking is 5.7%. The alcohol consumption during pregnancy is lower compared to our smoking behavior at 2.2%. And breastfeeding for at least first 6 months of life, and we are looking here at exclusive breastfeeding, is at 38.2%. And this is an interesting stat that we don't seem to discuss too often, which is co-sleeping with infant under 1 year, and it's 31.9% of the women that report co-sleeping with their child. Any interesting stats that shout out to you, please feel free to share your feedback or your own results that you might be working on in the chat. Right. So just to see what we believe to be, so these are proportion of deliveries that we observe across provinces, cesarean sections, proportional delivery by cesarean sections. Any thoughts on which province leads the Canadian stats? And I'm just going to be...
People in the chat are saying British Columbia.
And we would be right. And so these are the province-related stats that we see. Again, I downloaded this data set from the Canadian Surveillance System, and these are the province-related stats that we see, and this is an average from 2018 to 2022. Yeah, so yes, BC does stand high. The Canadian stats is 32%. So for the nation, that's where we stand. So this was looking at the Canadian trends and for provincial differences. Now I can go on and discuss some more statistics as well, but I would like to introduce two more data sources that I think is very important and provides us with a lot more information. So I'll turn to international comparisons now. And here I would lead you to the OECD's data set. which provides information on OECD countries. Right. So the one paper that really stands out in the last year, 2-3 years, is the discussion about the trauma after operative vaginal deliveries, and which came from McMaster. And this was comparing across different countries. And what we observe is that Canada leads, sadly, the rate of injuries in vaginal deliveries. And what we see is that not just that it leads, but it leads by a big margin as well. And so this graph is from the paper that comes out of McMaster, which was published in BMJ in 2023. And so what I would like to do is to take you actually to the data source and show you where the data exists and how to download this data set itself. And what the paper has done is an excellent job of trying to show you some correlations and provide you with reasons why Canada might be leading in this. And they provide, I think, 5 main reasons behind it. And so, again, this is the link. Some of you might want to access it as we are playing around with the data here. And so we have the OECD Data Explorers, and it's quite easy to use compared to the Canadian Surveillance System. You have search for keywords, or you can browse by topic. And it provides you with tables that can be downloaded and in either format. So that's what I did. I went to this website and I downloaded the data, and then I used Google Sheets to create the visuals in some cases, and in some cases used Excel to create the visuals, right? And so any of you grad students or trainees who are looking for research topics, this would be another place where you could explore the data. So what we're looking at is the trauma with instruments, and I would like you to note the numbers here. And let's go back to the article. And so these are the numbers that we're looking at here. So it's the same data set that we are accessing right now, but instead of just looking at it at one point in time, what I've done is show you the trend that we see from the data set. Yeah. And so you can consider this as what are the different ways that we can visually represent this data to see a story or a narrative that comes out. Yeah. And so what we observe here is that Canada does lead compared to other countries. I've kept the number of countries feared lesser than what the paper has, just because we are looking at a trend over time and we want to be able to distinguish between different countries. So we see that this is where United States is. Yeah. We see that these numbers since 2013 have been declining for Sweden, and they seem to be following a downward trend or staying the same for other countries. And New Zealand was, which I had to remove, saw a lot of changes over time. And for Canada, what we see is that there is a decline, a small, but a decline over time in these stats. Now, the other thing is I'm using 3-year moving averages. So this is let's use 2018. This is a 3-year moving average. So you're averaging 2019, 2018, 2017. And why do we do that? Because there were certain years that the data was missing, one, and also this looks at an overall trend rather than any dips or increases because of any year changes. Yeah. So the interest or the question here is to look at the trends. And so we look at the 3-year moving averages. Again, any interesting trends, happy to discuss this. What we see is for UK that we know have been adapting and are specifically focusing on these concerns, and we see that there has been a decline over time in UK, despite the fact that the numbers have been low since the early 2000s. And so what Canada here lacks is a focused aim or objective in reducing these caseloads. Now, I also wanted you to see the obstetric trauma from deliveries where you do not use instruments. And what we observe is that Canada leads in those as well. Yeah. And there is a slight increase in those trends. And so in both the cases, we see Canada leading, and by a very large margin as well. Okay? Now, another way to visually represent it would be to just look at both of these trends at the same time. There are two ways of representing it. One, you can have the y-axis measuring the stats at the same time for both of them. And then you can observe the differences across as well as a trend over time. Yeah. And so what about one of the reasons that was mentioned in the paper was training of healthcare workers. What I wanted to show you was the different stats that are available on that website. So one is looking at OBGYs per 1,000 live births. Now there's information about midwives, number of midwives per 1,000 live births as well, practicing midwives. And I have left that for you guys to look at and download. And again, it's from the same website and the same link for these stats. And so this is what we see over time and for the different countries. And this is per 1,000 live births. Yeah. And so what we generally observe, if you look at those numbers, again, these are the data set. This is the stats that I've downloaded, and I'm using Excel or Google Sheets to visually represent it. Right? So Switzerland stands at high at 22 OBGYs per 1,000 live births, and so on. So you do see that Australia, Canada do have a higher burden on OBGYs, and it's the same story for midwives as well. Yeah. And if we were to plot, so another way to visually show that there is a relation, and this is really picking up on the reasons that were provided in that paper from McMaster, and using one of the reasons to picking that up and using the data from the OECD to visually represent that correlation does seem to exist. And one of the factors that they mentioned does seem to play out even with the data or the statistics. And Canada has among the lower, a higher burden on OBGYs per 1,000 live births, and that seems to be translating into the vaginal traumas with instruments as well. And as we see that the burden on OBGYs increases, or the caseload decreases for OBGYs, we have more OBGYs per 1,000 live births, there seems to be a decline in the trauma cases as well. Yeah. Please feel free to share in the chat if anything is here obvious, or if something isn't obvious, or there are other papers that discuss this in more detail, or you've worked on something similar or exactly the same thing and would like to share with the rest of us. Yeah. All right, so I'll move on to the third data source. And Tomorrow, is there a way of you to share this link with everyone?
I'll just type it in the chat.
Okay. So feel free to access the link and to access the data source. Now, this is a fantastic place to look at some of the statistics, not just at the provincial level, but at the hospital level as well. Yeah. And so you can, what I'm showing you on the screen is what the website looks like once you go onto the website. So what you see here is the Canadian health system in brief, in depth, and some insights as well. Now, they also provide hospitals with a service that they can use to trace their own indicators over time and to compare their performance with other hospitals around in the same neighborhood or across countries. And they divide these hospitals by whether it's a teaching hospital or non-teaching, and also by their size. Yeah. And so once you enter the health system, you can search for your own province, or you can search for the hospital that you want to look at to see what the indicators are. And you can see the indicator results or compare them over time. And so you can either search by indicators, or you can search by province or by a specific hospital that you might be interested in. Now, so what I wanted to see was a stat which was slightly different from what we've been discussing. So these are obstetric patients readmitted to hospitals, and these are percentages. And so that's what I typed in, and I'm looking at stats for different hospitals across Canada, and I'm just so that we can visually see it. I'm showing you the results for Vancouver, and you can probably figure out which hospitals these are and compare the results across. And it seems to be around 3%, which is on the higher side, to 0.9%, and so on. Yeah. So let me compare two hospitals. Again, all this data is coming from the same website. Right. So let me compare two hospitals. And here we're looking at the Richmond Hospital and Vancouver Coastal Health and Providence Healthcare. And we are going to compare those numbers with all the teaching hospitals, the average numbers for British Columbia and for Canada. Yeah. So this is obstetric trauma with instruments. And keep in mind that these stats that I'm looking at are percentages, not per 100 live births. Okay, so what we see is that Providence Healthcare, the numbers are higher compared to the Canadian averages. If you look at the average for British Columbia or other teaching hospitals across Canada. So that's how the stats are divided. Okay. And if you look at the low risk cesarean sections, that's what the comparison is for the three hospitals. Yeah. And so we see Vancouver Coastal Health leading the C-sections. And again, I'm comparing three hospitals here just to show you what is possible with the data source that exists on this website. Yeah. And again, if you download this data set, you can look at trends as well. And that's what I've done here. That's from all obstetric cases. And here looking at the Canadian average over time. Yeah. And what we see is that there has been an sharp increase in some of the stats. I haven't used moving averages in these cases. And so you do see some annual changes, which are more than the trend. Again, just looking at the various cases over time. So these are the mortality rates per 100,000. Then you can, the other thing that CIHI provides us with is the patient experiences in Canada. And once you access this website, you can look at the patient experiences, performance assessments, and health equity and other indicators. Right. So just to start off, this is what we have, the link, and you can access these different stats. So just to show you an example, we have patients' experience. What did patients think about in terms of communication with doctors and nurses? And this seems to be painting a very positive picture. 2/3 of the patients said the doctors and nurses always listened carefully and explained things clearly to them. And then there are questions about patients' involvement. So this is involvement in decision making and treatment options. So 55% is how you look at this, but it does seem to be on the lower side if they feel that they were involved in the decision making or that their friends and family were involved in the decision making for their own treatment. Yeah. And so 57% said that they were involved as much as they wanted to. And 54% said that their friends or family were involved as much as they wanted them to be. Yeah. It doesn't paint a very good picture. They also have information by race. I'll leave this here to for you guys to see and to just point out anything that stands out. Although there are differences, so let me just walk you through what this graph looks like or what it's pointing. There are these rates are across two variables, one race, yeah, and the second is across age. So this orange color is for stats for people 18 to 59, and then you have age group 60 to 79 and 80 plus. So for all these, we do observe that depending upon whether patients feel, so again, it's patients' experience, whether they feel that they are being listened to, it declines with age. Yeah. And whether their family and friends are involved in the decision making seems to increase with age. So older people 80 plus, they feel they're not being listened to, but their friends and families are involved in the decision making. Yeah. So, and looking at this across racial differences, we observe small changes, and at the same time, they do exist. Yeah. And how it is being measured and which hospitals were involved, we can consider those and go into more detail on the website. Yeah. Anything that we right. And so the other one that I want to leave with you is this is an old one, and this is what I like to point out what we need, what started and did not continue. This is the Canadian hospital rate ranks by CBC, And what they have is they started working with hospitals to provide, to ask for these information. And they had a lot of difficulties trying to continue with it because either there was a pushback from the provinces or from the hospitals themselves, but mainly from the provinces in releasing this data. And so they were able to get information on uh, hospitals at that time. And I want to show you the ratings that two different hospitals got at that time, UBC and Sturgeon Community Hospital. Um, the grade for UBC hospital is D, and for Sturgeon is A plus. So I'm comparing to across the spectrum here. And so they look at mortality after major surgery, nursing, sensitive adverse events, uh, and adverse events, medical patients, surgical patients, and so on, readmission after surgery. So these are the different measures that they've used to create these rankings for hospitals. And then using these rankings, they come up with a ranking for a hospital itself. And so this is available for public as well to access what do the stats look like or what these numbers look like before they access a hospital. So they have all this information on hospitals before they actually go in. And there seems to be quite a big difference across these two hospitals, and the national average here is 29. Yeah. And so I'm just showing you a different, another source. Ontario seems to be trying to provide more information public, which is to the public. So this is something that they are working towards. And again, they're providing similar stats for similar variables that we have seen in this presentation. And there seems to be more focus on long-term care home as well. Yeah. And so I will pause here and stop here. And again, thanks for patience for at the start of this seminar, but any questions or insight that you might have. Again, I'll provide the slides online. We'll provide the slides online so that you can access these websites yourself. And I'll be happy to answer any questions that you might have later as well while you're playing around with this data. Feel free to get in touch with me for any help or assistance or feedback. So any questions or any insights that you guys might have?
All right, thank you, Dr. Malhotra. At this point, I'm going to stop the recording and open the floor to any questions.